Well, good morning, everybody. It's Thursday, February 11th, and this is our weekly operational status update call, and I'm glad that you're all joining us. At the end of last week, Weld County moved from level orange to level yellow on Colorado's COVID dial, and the university has adjusted its operations accordingly while maintaining protective measures. AVP for Administration, Blaine Nickerson, will give us an update about this in just a moment. As many of you know, the federal government extended additional relief to higher education, including funds to support students. I have approved a plan on how to distribute our higher education emergency relief funds. Much like last spring, the university will be distributing funds to all students, both undergraduate and graduate, recognizing that many of you have faced financial difficulties during the pandemic. We are working through the logistics of distributing this money in a very efficient manner, and students can expect to receive an email from UNC next week indicating how much money is available to them and how to claim their funds. I also want to assure our DACA students that the university will be providing, aid to you as well to meet your needs in this difficult time. On a non-COVID related note, I want to remind everyone that we have a Board of Trustees meeting tomorrow, beginning at 8:30 a.m. And we also have a meeting with the Board of Trustees Finance and Audit Committee this morning, beginning at 10 a.m. And the UNC community is invited to attend both of these meetings. And if you go to the unco.edu website, you can find out how to access both of those meetings. And with that, I'm going to hand things over to Blaine Nickerson for an update. Blaine.
Thank you, President Feinstein. Good morning, everyone. Hope you're staying warm. We're in for a big blast of Arctic air over this weekend. We may have high temps only in the single digits, and if we clear up at night, we could get as low as about 20 below. So definitely make sure you're taking care of your pipes and things like that. No hoses connected outside. Keep those doors open on the exterior wall, places where you have sinks and things like that. The state announced, as Andy said, the state announced changes to the color-coded dial system last Friday. Those took effect over the weekend. Weld County is now in level yellow, which has allowed us to loosen restrictions on capacity limits around our dining facilities, rec center, workplaces, and both indoor and outdoor events. Probably not a lot of outdoor events coming this weekend. A detailed explanation of these changes, they were included in the COVID digest that we sent out this week, and they're also available on our website, so feel free to check those out. The way the dial's calculated and adjusted has also been tweaked to make it more responsive. It's now based on a 1 week measure as opposed to 2, and it'll move between levels much more quickly. In the past, to move to a more restricted level, the county was given a warning and time to recover. And unfortunately, the state learned that that just didn't work. It was more important for us to rapidly be able to respond. Speaking of the dial, Weld County's sitting squarely in the yellow category for case rates and test positivity. The fast and steady drop that we saw after the new year throughout January has really plateaued. Our numbers are roughly the same as they were a week ago. Yesterday at a briefing, the state epidemiologist, Dr. Rachel Herlihy, said that we're seeing the same phenomenon statewide. Essentially, the rate of decline has slowed. Hopefully, during this period of lower disease transmission and hospitalizations, with both of those measures, we're back to numbers we haven't seen since back in about October. Hopefully, we can really make progress in vaccinating as many people as possible. The White House announced a 10% weekly increase in doses for states starting next week, which amounts to about 9,000 extra doses for Colorado. There was also promising news delivered to governors through the White House that Pfizer this week said they expect to deliver 50 million more doses than expected just here in the first quarter. Also, it's likely that the Johnson & Johnson one-shot vaccine will be authorized for use by the first week of March and immediately shipped. The committee that makes those decisions, I believe, meets on February 28th, and then there could be a decision very quickly after that. If that happens, we could nearly double our supply of vaccines in about a month. Dr. Fauci was actually on the Today Show this morning, and said he thought members of the general public might be able to start getting vaccinated in April. I actually share his optimism on the vaccine campaign. I think we're going to get to a point in late spring where we probably have a better supply than we do demand. And I'm really looking forward to that. I've also challenged our teams to start thinking about how we work on issues of vaccine hesitancy and things like that, particularly with our younger, healthier population of students. We're hopeful that we may receive some vaccine here at UNC next week, especially with those increased supplies, but no news on that front to share. Yesterday, the CDC issued additional recommendations related to masking. Dr. Fauci and others have been saying for weeks, we really need to up our mask game. The new recommendation is to always wear a multi-layer mask with a wire over the nose. There's a number of ways you can achieve that. You could wear a disposable surgical mask underneath the cloth mask, or you could just wear a surgical mask that's been modified to fit your face tightly, such as by tying the ear loops to eliminate those gaps along the side. You could also wear a KN95 mask. These better surgical and K95 masks are widely available at retail locations. I've seen them at Home Depot and Costco and King Soopers. They're really easy to come by. The reason for the new recommendations is that research has shown how much more effective those masking strategies are. And they're a great defense against the more transmissible UK or B117 variant, which, as the state epidemiologist put it, it's more sticky. It binds to the cells in your nose and your mouth more easily. So eliminating those transmission routes is really important. Here on campus, cases are holding steady and they've remained very manageable. We're monitoring 74 individuals in isolation or quarantine. Of those 74, 9 are employees, the rest are students. We have 26 active positive cases, only 1 is an employee. And of our 84 isolation and quarantine rooms on campus, we're only using 12. As I wrap up, just a reminder about the new testing site on campus. It's easy to drive up to and get tested. You don't even have to get out of your car. It's fast, it's free, it's easy. I'd recommend folks, symptomatic or not, pop in for a test every week or two. I know, Andy, you get tested every week. And I just think that's a great practice and a great way to help keep spread from happening from people who may be asymptomatic. So with that, I'll happy to turn it back over to you, Andy.
Thanks, Blaine. And now let's hear from our Provost, Mark Anderson, and our Student Affairs Vice President, Katrina Rodriguez. Mark.
Thank you very much, Andy. As I look out my window here at Carter Hall, it looks like a snow globe outside today. It's beautiful here on campus. Well, good morning, everybody. As we continue to bring more instructional effort back to campus, I want to use this as an opportunity to highlight some of the exceptional practice that our faculty have engaged in to meet and often exceed the learning objectives of our courses. While much of the face-to-face instruction occurs on campus, many programs at UNC also have practicum, field work, or clinical experiences that typically occur face-to-face, but in the community, not in our campus. In these cases, the COVID restrictions on instruction are not dependent just on the UNC policies, but those of partner institutions. Kim Mirza, along with Tina Farrell, work with graduate students in teaching the clinical practice of speech-language pathology. This year, they've moved the application portion of the course from the public school setting to a telepractice setting. In this course, Kim and Tina help the graduate students to build learning kits that are delivered to the public schools, who then distribute these kits to the families that the graduate students are working with. Once a week, using Zoom, the graduate students engage in an hour-long session that involves group reading, an engagement activity that involves motor skills, and language development activities for the young children that they're working it with. In breakout sessions, the graduate students facilitate language and pre-literacy learning for these children. Feedback from the families has been enthusiastic, with some saying that the customized telesessions have resulted in better outcomes for their child than what the student was getting in the public school. A benefit from this shift of the course is that graduate students have recognized that using telepractice as a mechanism for reaching students in areas of the states, particularly rural areas of the states, that wouldn't normally have access to these types of services. Telehealth provides a peek into the future of healthcare, and our faculty in the audiology and speech language sciences are providing experiences to our students that prepare them for the exciting future of telehealth. I want to thank Kim and Tina for just another example of how our UNC faculty are taking the restrictions imposed by coronavirus and finding new ways to enhance our student learning. We must remain diligent in masking, social distancing, and washing our hands, particularly as we get more and more face-to-face instruction. And with that, I would like to turn the podium over to Katrina.
Good morning, everybody. Hope you're doing well on this cold morning. So I get to spend some time with some really cool things this morning. As many of you may know, the Cesar Chavez Cultural Center is celebrating its 35th anniversary here at UNC. And as part of the anniversary, we are working with alumna of the university. I'm drawing up Armando Silva to create a mural for us. And we will have an unveiling of that next Wednesday. So the project is to commemorate the Chavez Center 35th anniversary and demonstrate gratitude and respect to those who came before us and exemplify a legacy of paying it forward. We have two students who are staff of the Cesar Chavez Center. Miriam Renteria Gonzalez is the Program and Assessment Coordinator, and she is a senior majoring in Mexican American Studies with a Social Justice and Public Policy concentration and an Africana Studies and Leadership Studies minor. She identifies as first generation, a dreamer, and a woman of color, and she's very passionate about social justice and creating spaces for all identities. And then secondly, her co-chair is Yadreni Caporacini. She's the historian with a focus on the 35th anniversary celebration that they've been doing all year. She's a double major in psychology and Mexican American studies with an emphasis on youth advocacy. She was born and raised here in Lafayette, Colorado. I'm just impressed. Our students have all these majors and minors and all the things they're involved in. It's just astounding how amazing UNC students are. So they've been working with Armando since the beginning of fall. They hosted a number of campus calls to narrow ideas for the mural and serve between that liaison between student feedback and Armando to finalize the image. So what I love is this organic opportunity for folks to come together to talk about what does a mural look like for a 35th anniversary, and what is it that we want to have the campus have that representation for the center. So they are also working with facilities management to finalize the location of the mural in Campus Commons. So I can't wait to see it. So next Wednesday, the 17th at 4 o'clock, Miriam and Yadreni will be hosting a Zoom call to unveil the mural and have a conversation with Armando about his perspective of the mural and the colors, the images, all that kind of stuff. So that should be really fascinating. So I just encourage folks, if you want to go to the Cesar Chavez Cultural Center, you'll be able to click on the event and register so you can get the Zoom link. So please do that. I think this is going to be a tremendous opportunity. Secondly, we have our housing and residential education program. Michael Klitsky is the Assistant Director of Academic Programs, and he was notified by the Association of College and University Housing Officers International, so it's an international professional association, that our HRE department was named as a finalist for this year's Benchworks Assessment and Impact Awards. These awards are given annually to programs that are using data from the Akuho-I Benchworks assessment to improve their on-campus housing experience for students. And typically, they do allow programs to self-nominate, but their analytics and research team is nominating HRE because they identified our program here as having a significant increase on satisfaction in community environment factor score. So after reviewing all the national data, and UNC's HRE department came up at the top over the past 2 years. So the next stage will be to have an interview with Michael or others in the department, and then they'll be letting us know if, in fact, our HRE will be the recipient of this award this year. So this is huge. All of the work that HRE has done this year, partnered with dining to make an experience so impactful for residents during the pandemic, where they have had such incredible the pivot they've had to do constantly. I just am so proud of them and their hard work, and I just want to shout to the rooftops just how wonderful this is to be acknowledged in this way. I can't imagine how great they're feeling. So send good energy that they are the finalists, and to be recognized by this international association is tremendous. So that's my good news for today. Andy, I'll send it back over to you.
Great news, Katrina, and thanks for sharing. And thank you, Mark, for your presentation. And Blaine, thanks everybody for tuning in. And as always, stay safe, be healthy, and we'll see you here again next Thursday. Take care, everybody.